I'm Mark Alexander, the director of the publication Point of View, and we are visiting with Dr. Bennett and Dr. Maguire in the heart of gene therapy. How did you get to start?
Well, this started when we were in medical school. I was working in a laboratory studying retinal diseases, and it occurred to me that a lot of them were caused by a single gene. And I had wondered if you just replace the gene, fix it, if you could fix a disease. And I asked Jean, my wife, whether that was possible. And I'll let you take that.
And I said, sure, it's a snap. Well, we didn't really think it was going to be a snap. But of course, we couldn't do it right then because most of the genes had not even been identified, let alone cloned. And there were not the technology to deliver genes to cells in the eye and have them stay there in a stable fashion did not exist at that point. So we spent the past approximately 25 years working on this idea along with many other people who were developing different aspects of the technology making this possible. And we made a great deal of progress, particularly in the 90s. And around that same time, animal models of the human diseases were identified and became available, and it was possible to test this sort of approach in the animals. And it was a success, at least in this one model with the Leber's congenital amaurosis.
And what animal did you use?
So the animal that has received the most attention recently is a dog model. It's a Swedish Briard that was born with this blinding condition. It's a spontaneous mutant.
The beauty of this condition is that the nerve cells in this disease don't die. They're there. They're just not primed with the right chemical moiety which captures light. So the nerve cells are there. It's like your car is in the garage, but and it's the gas is in the tank, but all you got to turn is the key, but there's no key. The cells are there in this condition, at least for a while. They do degenerate after a while, but without this one enzyme product, there's no vision.
So do you mean that you could only treat young persons or young animals?
Well, not totally. It over time, the amount of response that you get, the efficacy goes down because eventually the cells wither away so that you have nothing. So the younger you treat, and that's been our philosophy about our human trial, the younger you treat, the better chance it's going to work and you're going to have a very good result.
What result did you obtain so far?
We just reported on a study involving 12 patients. The youngest was 8 years old. He turned 2 days before his injection, and the oldest was 44. And each one of those subjects was blind at the start of the experiment and severely visually impaired at different levels because this is a progressive disease. And we found that each one of these patients gained significant levels of visual function, retinal function after the injection. 7 of the 12 people gained significant improvements in visual acuity, being able to read the eye chart, and others with visual fields, and all of them gained increased light sensitivity. But most remarkably, the children gained the ability to navigate by themselves. Before this surgery, they needed to use a cane or hold their parents' hands. And after the injection, they could navigate independently, ride bicycles, play baseball, be in a regular classroom, and be able to read books, which they could not do before. So that's been really magnificent.
They all have the same disease?
They all had the same disease, all had mutations in a gene called RPE65. Stands for retinal pigment epithelium, 65 kilodalton protein. They had different mutations, but they had the same phenotype.
What it does essentially is you need vitamin A to be in the proper configuration to load the nerve cells in the retina. Without that, the nerve cells can't capture light, and that enzyme is required to take vitamin A and put it in the form that gives vision.
Could you describe how do you get this gene back onto the retina?
We cloned the gene in the laboratory right here and packaged it inside of a shell of a virus which, even in its wild-type form, doesn't cause any disease or harm. And then delivered this...
Then there's the mechanical part, the plumber's part. There's a type of surgery that's been around for decades called vitrectomy, and taking a development that's fairly recent where you can inject material underneath the retina. We just took the same devices. You place this little cannula that's the size of about 3 hairs on your head that's wrapped together, and inject the material under the retina, and within a few hours it gets absorbed, and that's all there is to it. It's a short operation. In fact, the consent form for the operation, the consent takes longer than the operation itself.
And how common is that disease?
I'll let you answer this.
It's quite rare.
Quite rare.
There are an estimated 450 to 500 people with this particular form, this gene defect, in the United States. Maybe 4 or 5 babies born every year with this disease. Mm-hmm. But we think it's a prototype for moving to other more common diseases.
But do you have hope that you can extend your trials to other diseases?
Absolutely. We think this is a stepping stone towards being able to develop similar treatments for other forms of inherited retinal degeneration, including retinitis pigmentosa, other forms of Leber's congenital amaurosis, Stargardt disease, choroideremia, and ultimately it may be possible to use this sort of approach even to treat the very common disease, age-related macular degeneration.
The beauty about gene therapy in the eye, and what this trial shows, the results show this is going to be long-lasting. It appears to be very, very safe, very well tolerated. The amount of material you need, because it's a tissue that's so small, the amount of material you need is small. The body's immune system doesn't really even get involved, which is great when you're introducing a foreign material, and it bodes well for eye conditions especially.
When this drug is approved by the FDA, which I believe it has to be, do you believe it could be used anywhere in the world and by any kind of retinal surgeon? Well,
that was the intent to begin with, is to develop a procedure, the surgical procedure, which any well-trained retinal specialist could use. So I adapted the surgical procedures from things that had already been worked out and people were familiar with. So in that sense, certainly it could be done at any center, and I think when the drug is licensed, there's no reason that it can't be shipped and used pretty much anywhere.
And how often does the drug have to be used on one eye? Is it one shot for all or several shots?
Well, as we found in the animal model, we're thinking of the first dog that got treated, Lancelot. The dog was treated once. He's now 9.5 years old. No diminution, no decrease in the effect, and that's what's known in terms of the laboratory studies about the duration of effect of Adeno-Associated virus when it transfers genes into a tissue. The retina cells don't die off, they don't replicate, so what you put in should stay in, and it should stay that way indefinitely.
It may be desirable to go in and treat additional parts of the retina, which could happen in the future if it appears safe in animal studies, and certainly to go back and inject the contralateral eye at a later time point.
So it sounds very exciting. Well, Dr. Bennett and Dr. Maguire, I thank you very much for the time, and I'm sure that you are on a real breakthrough, and we should continue to hear from you in the future.
Thank you.
Thank you.